Next, assess the carotid pulse. The carotid pulse provides valuable information about cardiac function and is especially useful for detecting aortic valve stenosis or aortic insufficiency. Your assessment will include both palpation to assess the amplitude and contour of the carotid upstroke, and auscultation for the presence or absence of overlying bruits. You should assess both the right and left carotid arteries, then compare. However, do not press on both carotid arteries at once. Assessment of the right carotid artery is demonstrated here. With the patient still lying supine, and with the head of the bed or examining table still elevated to about 30 degrees, inspect the neck for carotid pulsations. Place your index and middle fingers, or your thumb, on the right carotid artery in the lower third of the neck. You should press just inside the medial border of a well-relaxed sternomastoid muscle, roughly at the level of the cricoid cartilage. Slowly increase pressure until you feel a maximal pulsation. Then slowly decrease pressure until you best sense the arterial pressure wave and contour. Try to assess the amplitude of the pulse. This correlates reasonably well with the pulse pressure. The contour of the pulse wave, that is, the speed of the upstroke, the duration of its summit, and the speed of the downstroke. The normal upstroke is brisk, smooth, and rapid, and follows S1 almost immediately. The summit is smooth, rounded, and roughly mid-systolic. The downstroke is less abrupt than the upstroke. During palpation of the carotid artery, you may detect humming vibrations or thrills that feel like the throat of a purring cat. Routinely, but especially in the presence of a thrill, you should listen over both carotid arteries with the diaphragm of your stethoscope. Ask the patient to hold breathing for a moment.
Hold your breath.
So that breath sounds do not obscure the vascular sound. Listen for a bruit, which is a whooshing, murmur-like sound of vascular rather than cardiac origin. A bruit suggests arterial narrowing. If present, a bruit would sound like this. You should also listen for bruits over the carotid arteries if the patient is middle-aged or elderly, or if you suspect cerebrovascular disease. Note that heart sounds alone do not constitute a bruit.